Broome County's medical director is cautioning the public that while on the whole, area residents are well protected against vaccine-preventable diseases, there are still a number of troubling cases. Dr. Lazarus Gehring of the County Health Department says the success of vaccines against such diseases as measles, polio, and chickenpox has led to a level of cultural amnesia about just how threatening those illnesses can be. Gehring says that over the 6 months since he became medical director in Broome County, there have been multiple outbreaks in Broome and surrounding counties. He says 45 children contracted chickenpox or varicella, and none of them were vaccinated. A child under 6 months old had to be hospitalized with meningitis, and while that infant was too young to be vaccinated, the lack of vaccinations among older children is what put that baby at risk. Gehring says a 3-year-old died of Haemophilus influenza, another vaccine-preventable infection. And Broome saw 6 times the normal rate of whooping cough last year. Gehring says all of the publicity about those who are vaccine skeptics may give people the wrong impression that vaccination rates are lower and therefore less significant. He says rates do remain high, especially for childhood vaccines, which makes those instances when someone is seriously ill from a preventable disease all the more disturbing.
In case people are thinking, well, wow, these vaccines don't work, a lot of people don't use them, that's actually wrong. Now in New York, those are required for school. But outside of that, even those who are older are quite vaccinated against some of these things. And that's why they don't get up off the ground.
Gehring says there are now more effective vaccines for older adults than ever before, including for shingles, RSV, pneumonia, and of course flu and COVID. He says a case of meningitis at Binghamton University last fall led to a high exposure event in which 30 people were exposed. None of them contracted the illness, though, which Gehring attributes to vaccination.